Okay, so hydrocodone, aka Norco or Hydro, first originated in Germany in the early 1920s. It comes from the resin of poppy seeds, which are shown above. Um, People use this medication in order to get high. It becomes abuse when, instead of taking it orally and working over the course of 12 hours, people crush the pill and inhale it, making it hit the central nervous system all at once. Inhaling or injecting Norco increases the risk of addiction and overdose. The mechanism of actions of hydrocodone is an opioid receptor agonist and produces analgesic effects by activating the mu opioid receptors. It activates the opioid receptors, which inhibit neurotransmitters release, including substance. Hydrocodone reaches maximum serum concentration in 1 hour with an elimination half-life of 46 hours. The neurotransmitter that hydrocodone mimics or interferes with is endorphins. It reduces the excitability of neurons and it creates an euphoric effect. It moderates hunger, thirst, and pain reactions, and it also involves mood control. The clinical manifestation or symptoms of drugs on the whole body are slowed heart rate, anxiety, difficulty breathing, and during overdoses, coma, and having seizures. When people inhale hydrocodone, they can get constipated, get dizziness, drowsiness, or weaknesses. In the metabolism refers to the process of biotransformation by which drugs are broken down so that they can be eliminated by the body. Many require metabolism to enable them to reach their target site in an appropriate amount of time, remain there an adequate time, and then be eliminated from the body. Hydrocodone metabolism results in the production of both inactive and active metabolites. Most opioids undergo extensive first-pass metabolism in the liver before entering the systemic circulation. Hydrocodone is a Schedule II drug. Schedule III drug are defined as drugs with moderate to low potential for abuse, whereas Schedule II drugs are defined as a drug with a high potential for abuse. In 2014, the Drug Enforcement Administration, DEA, changed the hydrocodone from Schedule III to Schedule II. In just New Mexico in 2003, 48 people died of overdose from hydrocodone. After October 6, 2014, prescribers cannot authorize refills for hydrocodone. In the immune system, a sign people notice when someone is addicted to hydrocodone is they get frequently ill. This is because short and long-term use of the drug can weaken the immune system. Since it depresses the functions of the cells in the body, it does not allow them to fight viral and bacterial infections. The important functions of the immune system. Hydrocodone accesses the mu, delta, and kappa opioid receptors. Exogenous and endogenous opioids can affect the innate and acquired immune systems and influence the immune response by interacting with the activation of different opioid receptors. Hydrocodone significantly impairs various aspects of the innate immune system, being the first line of defense against the invading pathogens, which we talked about in the previous slide. Hydrocodone abusers have higher risk of developing bacterial skin, soft tissue, respiratory tract, endovascular infections. Trigger thymus gland atrophy, increase susceptibility to infections, enhance the growth of implanted tumors, and decrease helpful T lymphocyte numbers. Some fun facts about hydrocodone is Hearing loss has been reported as one of the possible side effects of hydrocodone abuse. And hydrocodone is one of the most dangerous opioids someone can abuse. And that's my thing.